Today we're going to talk about Kinesio tape. There's a lot of interest in Kinesio tape, so we're going to talk about how it works, when you shouldn't use it, and some application techniques. My name is Jeff Petersen. I'm with Petersen Physical Therapy. And if this is a helpful video, please hit the like, share, and subscribe button, and feel free to smash that other button that will give you notifications. So, Kinesio tape. It started back in the 70s. It was invented in Japan. This is a different version. Kinesio tape is a trademark tape. There's many versions of it. Some people call it K-tape or kinesiology tape, but it's all similar. One of the things that makes it different from the old tape that we used to use, the old white athletic tape, is if you look real closely, you can see there's a very specific weave pattern, and there's also a certain amount of elasticity to it. So that's what makes it unique and how it works. And I want to just summarize how it works. In our bodies, if you imagine if this was a ligament, there are ligaments, there are joint capsules, there are tendons, and when we move and bend and stretch, there's tension created within those tissues. There are small nerve endings embedded in each one of those tissues that when you generate tension within one tissue, it's going to register a signal to your brain. Those are called mechanoreceptors. So that if this were the ligament on the outside of my ankle, so I'm going to get my ankle here. Can you see that? And I turn that ankle in. Well, those ligaments on the outside are going to stretch. If they stretch beyond the ligament's ability to withstand that energy, that's going to be an ankle sprain. When you have an ankle sprain or a ligament sprain of any kind, they grade them. A grade 1 ankle sprain is when those ligaments are stretched. Much like the socks that you have at home that don't stick to your leg, or the sweater that gets too big because it gets stretched out until it's laundered again. So that would be a grade 1. A grade 2 is up to about 50% of those fibers are actually torn. And a grade 3 is a complete rupture. Grade 3s rarely heal, and you tend to need surgery to repair those. But a grade 1 or 2 can heal. Grade 2, it depends. But even if you have a grade 1 sprain where those ligaments are stretched, those little nerve endings that are embedded in those ligaments get damaged. So that as your ankle starts to turn, there's not enough tension generated, and you don't get the signal, and you tend to go over. And that's what happens after you sprain your ankle. Anyone who's sprained their ankle will notice it's easier to sprain it again or to turn that ankle again. So that's called proprioception. Proprioception is the awareness of where your joints are in space. So one of the proposed mechanisms of Kinesio tape is it offers stimulation to the tissue on the outside through the skin that supplements the lack of information you might be getting from a specific ligament to give you more neurological stability, not mechanical stability. The other suggested mechanism is because of this unique weave pattern that it will actually lift the top layer of tissue, the skin, from the underlying layers of tissue, the fascia and some of the lymph vessels, so it will improve the circulation and help reduce swelling. So that's the suggested mechanism. The only real problems that you can get with Kinesio tape is if you put too much tension on it when you apply it, or if you're sensitive to the glue, you can get some skin irritation or some contact dermatitis. You can create some itching or burning. So what I always tell patients is, if the tape is helpful, you can leave it on, and you can leave it on for 2 or 3 days at a time. You can shower with it as long as you don't scrub over it. If you don't use a lot of lotion on your legs, it will easily stick to your skin. Here in the clinic, we will use a spray that's basically aerosol pine tar that helps increase the stickiness. And so the main thing is if it itches or burns and you get any kind of irritation, you want to just take the tape off. So we're going to talk about some different areas that we tape. In the clinic, we tend to tape low back. So if you think about a low back injury, a disc, a joint sprain in the low back, some of those mechanoreceptors might be lost, and you need to increase the awareness of where your back is in space. An interesting aside is that if you look at the type of mechanoreceptors, there's generally type 3 mechanical receptors in the joint capsules. If you look at the type that are in the hand, that dominate the hand, it's the same type that's in the low back. And so when I first learned that, I realized this big, thick section of me is really designed for fine motor activity, just like my hands or someone who plays the piano. And so that was kind of a different perspective. So kinesio tape can be helpful in improving the awareness of where your back is in space. What I would like to do is demonstrate a couple techniques with Laura, if she'd be so kind. And let's have you start, and you can just take your shoe off for me if you would.
Any shoe?
Yeah, actually, yeah, that right one. You can lie down right here so your foot is right in front of the camera. Beautiful.
You got it.
Okay, so we're not going to actually apply the tape to Laura's foot, but Jeremy, if you want to come over here, I'm going to show you the ways that we would. And later on in the video, you're going to see some pictures of the techniques that we did. If you look at the back, and all the kinesio tapes are like this, they have little measuring lines that are 2 inches long. So for the average ankle, I usually do a 5, a 6, and a 3. So with the 5, what I do with the foot in a relaxed position is I secure one box here, and then I stretch it. Now when I put tension on the tape, I do not put 100% tension on the tape because that could irritate the skin. What I do is about 50% of the tension for the tape. And once I get this going here, I'll show you that. Yeah, there you go. So this would be 100% tension. I don't want to do that. I would secure with my fingers here. Now heat helps the glue stick. So you secure, warm it up a little bit, about 50% tension, and I come up to the outside of the leg, just on the other side of this tibia, and I would secure it. Then I would take another piece, and I would go under the foot, and I would pull it up and out to the outside, 50% tension, not 100%, but about 50%, a little bit longer piece, and I would secure it to the same spot. And then I would take a smaller piece, a three box piece, and I would secure it across the top of the ankle to hold it down. That acts like a retinaculum. There's a ligament. So when you're pulling on this, now the second piece I do, I'm going to make sure she's holding her foot in a neutral position like that. That's going to increase the awareness of where her ankle is in space should she have suffered a lateral ankle sprain or turning the ankle in, which is the most common mechanism of an ankle sprain. And again, she could wear that for 2 to 3 days. She can shower as long as she doesn't scrub on it. And as long as it doesn't itch or burn, she's fine keeping the tape on. Okay, let's look at the shoulder. So another common area, and you can just face the camera if you would. The other common area that we're going to tape, and you'll see this one, there's a picture of me. I taped Mike. He's a baseball pitcher. He's a lefty. So we've got the shoulder here. Now keep in mind, when we talk about the shoulder in physical therapy, we talk about the collarbone, the shoulder blade. So can you turn sideways a little bit? So the shoulder blade is here. That's the scapula. At the end of the scapula is really the socket for the ball and socket. So the collarbone, the shoulder blade, and then the humerus or the ball and socket. Okay, now you can turn back this way. And that's why oftentimes people come in and they have a shoulder injury, an impingement syndrome, rotator cuff tear, and they complain of neck pain, mid-back pain, because the muscles that attach to the shoulder blade also attach to the neck. As a matter of fact, one of the shoulder muscles, the latissimus, let's have you turn around again for me, please. One of the muscles, the latissimus, attaches up here to the humerus, in the back of the humerus, and it comes all the way down and broadens out and attaches to a thick connective tissue fascia in the low back. So you can have a shoulder problem and get some low back pain. All right, let's have you turn back. So, for taping the shoulder, so one of the things I want to show you is cutting it. Is when we cut the Kinesio tape, and I'll show you in front of the camera here, we always want to trim the edges, because you see how this is square? Those edges can get caught on your clothes. They can get caught when you're moving, so we always like to round off the corners. And when you buy Kinesio tape pre-cut, you'll see they have the rounded corners. So you can get this tape at any, I think at Dick's. I don't think you can get it at Walgreens, sometimes at Walgreens, Walmart. So when we tape the shoulder in a relaxed position with the arm up, or the hand up, so the biceps is facing out, I would secure the tape here, heat it up, 50% tension, and I would come up over the acromion, which is part of the shoulder blade, and the clavicle, the AC joint. Then I would take a smaller piece, about 4 boxes long, and I would start with on the deltoid tubercle. The deltoids come here. There's a little tubercle right there on the deltoid. I come in 1 box below that, and I would gently, 50% tension, pull it right up to the top of the shoulder there. Okay, and now we're going to have you turn and sit with your legs here. And then on the last one, again, when we look at the shoulder blade, you can see I'm feeling her shoulder blade right here. There's an angle right here. I'm going to come across here. And what I will cue a patient to do is you're going to pull this down and back and relax right there. Okay, so with the shoulder blade in this position, that ball, or that socket for the ball to sit in is positioned kind of laterally and up a little bit. If it's here, then the ball is looking down and forward, and that's when you can get some issues in the shoulder. So we bring that there for the last piece, and then what I'll normally do is I'll attach it on top of those other 2, right in front of that acromioclavicular joint, right in that little tender spot. And I'll put 50% tension, and then I'll catch the inferior angle or that lower angle of the scapula and secure it. And that's going to hold her shoulder in a nice position. Okay, the last one I want to show you is the low back. So if you're having some low back issues, let's have you lie on your stomach, please.
Okay.
So for someone Laura's size, and there's a couple different ways to do this. If you look at Kinesio tape or rock tape is another type, sometimes they'll have you in flexion. What I'll do is I usually have the patient in a neutral position here, so they're nice and straight. Right now, where my finger is right where her sacrum meets her lumbar spine. Okay, and we can show you a picture of that in a little bit. But that's where her sacrum meets her lumbar spine. She's got an iliac crest right here. I'm going to catch the top of her glute here when I put the tape on. But the first thing I'm going to do is take about a box that's about 4 boxes, or a tape that's about 4 boxes long. So it's usually about this long. And I'm going to put it right across the segment that I think is in lesion or has a problem. Again, I'm going to secure 1 box, 50% tension, secure the other box. And then I'm going to take another piece and I'm going to find that gluteal muscle right there. And I'm going to secure 1 box there, 50% tension, and then I'm going to secure that in an angular fashion. It's an oblique angle here, and I'm going to secure that one there. And then I'm going to do another one on this side where I grab the top of that glute muscle, 50% tension, and secure the tape there. And that will create a star pattern right in the low back. What it does is it stimulates the skin. It gives additional information in through those segments, into the spinal cord to the brain, and it increases the awareness of where her back is in space. Because keeping in mind that the low back is really a fine motor tool, just like your hands, yet we don't care for our backs like they're fine motor tools. We care for them like it's kind of a big lump there. Okay, thank you, Laura.
You're welcome.
So one of the things I wanted to show you is that if you do have some tape on your skin. And let's just say, for example, that you have tape on your skin, your therapist has taped you, or you've taped yourself, and for some reason it's not helpful and you want to take it off, or it's time to take it off. You have to be careful because your skin can be fragile. You don't want to lift straight up. What you want to try to do is just gently peel back on the tape. If you peel back on the tape, it'll easily remove from the skin without tearing the skin. If you have hairy arms like many men do, it will not pull many hairs off, but
It doesn't hurt at all.
so you want to make sure you're very gentle when you pull the tape off. So in summary, kinesio tape can be really helpful if you're active, if you have some joint instability. You can always ask your therapist to try taping you, but you can also try taping yourself. And most of the boxes that you buy will have other techniques that you can try. These are the techniques that we try. We also use it for the Achilles tendon, to fasciitis, for Achilles tendonitis, and sometimes for lateral epicondylitis or tennis elbow.